Welcome to Friday's edition of COVID-19. A recent survey of 1,000 adults by a local university found that 1 out of 4 opposes inoculation. The finding reportedly comes amid news of adverse reactions and cases of vaccination mishaps. Now, we have more on that later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so do start us off then.
Sure, Sunny. So Friday's figure of total cases stands at 1,892, which is a decline by more than 200 cases from the day before. 1,857 of those are domestic transmissions and 35 cases are from abroad. Now, despite the drop from the day before here, Friday's figure marks an increase by more than 180 cases from last Friday. And with that, Korea is approaching 270,000 cases in total when it comes to the accumulated caseload here in Korea.
Right, so and while the daily tally has been holding steady, I understand the proportion of cases here in the Greater Seoul area has been on the rise.
Right, Sunny. So that proportion has been standing at above 70% lately. And now this Friday, it even stands at close to 75%. So if you take a closer look, the capital Seoul, Gyeonggi-do province and Incheon here, which make up the capital region, accounted for more than 1,400 cases this Friday. And it's been 5 days now since the government has extended social distancing measures for another month. However, with some adjustments to operating hours for businesses, as well as the number of people that can get together for private gatherings based on their vaccine status. Despite that, authorities say that these changes should not be misinterpreted.
No matter how high the vaccination rate, a return to normal could become a distant dream if the spread of the virus isn't contained. Although the latest government measures take into consideration the vaccination rate, hardships faced by business owners, and the sacrifices made by our nation's people, who even abstained from visiting their hometowns in the past 2 major holidays, this is not a relaxation of prevention measures.
And to prevent a wider spread of the virus during the Chuseok holidays, the government has designated a special antivirus period beginning on Monday for 2 weeks. And there will be tighter inspections and more temporary test centers. Also, this Friday, the government has issued an administrative order in regions outside the capital area to expand hospital beds for COVID-19 patients. Let's also get a quick look on the vaccination figures. 62.6% of the nation's population has now received at least 1 dose of COVID-19 vaccine. Meanwhile, abroad, the U.S. now has issued a vaccine mandate for federal workers, and large businesses are requiring their employees to get vaccinated or get tested for COVID-19 every week. And the UK, meanwhile, has given the green light for AstraZeneca and Pfizer booster shots, but when the booster shot program will start has not been decided yet. Meanwhile, the U.S. and the UK are also seeing the highest daily figures in the past day, followed by Brazil. And the total number of infections around the world now stands at 224 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for the update. Right, today, that is Friday, marks day 600 since Korea reported its first case of COVID-19. Much has transpired since then, with authorities now plotting an exit plan from the pandemic, having inoculated over 60% of the population with at least 1 dose. I have Cho Won-jung here in the studio today with more on his coverage of COVID-19 over the past year and a half. Won-jung, welcome.
Good to be here.
Right, so you've been covering the pandemic since day one, and you continue to do so. What has it been like?
So let me begin by saying what a journey has been in covering, reporting on the pandemic for nearly 2 years now. I still remember early days when the daily tallies used to be just a single or a double digits. But little did I imagine that we now see the more than 260,000 total cases. And also I want to point out the Korean government has put up a fight to contain the virus the best they could. And that's something I want to point out or like to share with you today in more detail. Before a vaccine became available, testing and along with tracing and treatment formed the backbone of the Korean containment strategy. Back in May, the Seoul's nightlife district of Itaewon was hit by the large cluster outbreak, and many people who were there were reluctant to come forward and get tested out of privacy concerns. The government found a solution, though, by offering anonymous testing throughout the city, and that encouraged thousands and thousands of people to get tested at the time, which helped to contain the outbreak before it spread any further. And speaking of testing, Korea applied innovative ideas like walk-in and drive-through test centers to allow for quicker screenings, as well as a non-contact testing center to protect healthcare workers.
Right, and Wonjong, authorities didn't stop there. Once vaccines began rolling out, they were up for a new task, right?
Right, so to maintain a reliable cold chain was one of the biggest challenges for the Korean government. And I had a chance to step inside the storage room for Pfizer vaccine, where I believe the temperature was below minus 80 degrees Celsius. I was able to witness firsthand how efficiently the vaccines were stored, handled, and transported. Korea's vaccination campaign may have started off a bit late compared to the countries like the US and the UK, but it's now vaccinating more than 60% of the nation's people, thanks to the vast infrastructure up and running.
Right, over 60% of the population with one dose as we speak, Wonjong. And I hear you got your first shot this week, right?
Yes, I did. In fact, I still feel a little sore in my left arm right now. Thankfully, no major side effects. And I'm sure there are many viewers out there who are looking forward to seeing what the vaccination process will look like. So let's take a look.
Wednesday, September 8th was the day I finally got vaccinated. My original appointment was for September 30th, which I thought was a bit late. Health authorities have been allowing people with vaccine appointments after Chuseok to reschedule to earlier date as a part of efforts to reach a vaccination rate of 70% before the holidays. I was able to move my appointment as well and got my vaccine 3 weeks earlier. On the day I got my vaccine, I was worried about its potential side effects, but thankfully, the medical staff on site were eager to answer all of my questions.
타이레놀이 조금 의문이었는데 뭐 먼저 먹을 필요는 없다는 거죠?
미리 그걸 예방하기 위해서 먹을 필요는 없습니다. 그것 자체도 부작용이 있기 때문에요.
Finally, it was my turn to get the shot. A medical worker there double-checked all the details with me to make sure I was getting the right dose.
오늘 몇 차인지 알고 계세요?
오늘 1차 접종입니다.
맞아요.
Okay, I'm not usually afraid of needles, but I was much more nervous than I had expected.
깔끔합니다. 움직이지 마세요.
I got my bandage and on to the next step, waiting 15 minutes to monitor for potential side effects. Then I was curious if others were also worried about side effects.
부작용이 걱정되는 것도 사실
I too was worried about vaccine side effects, but getting inoculated is still the right thing to do if I want to keep my family safe. Protecting them far outweighs the risk of the possible side effects.
A nurse who's been assigned here since July was forced to leave her hometown in the process, said that she feels a personal responsibility to do her part for the greater good.
힘든 건 사실이지만
It's true that the work is exhausting, but I feel like I've done my part when I see the country's vaccination rate climbing higher. I would like to continue working until everyone has been vaccinated. That is my goal.
So now I feel like I have an extra layer of the ease and confidence in knowing that I have a lower chance of maybe the passing of the COVID-19, to especially my friends and family and maybe the people that I interview every day at work.
Right, and that goes to the two of us, Wonjong. All right, thank you for that report.
Thank you.
Right, it's time now for the regular afternoon briefing on the pandemic situation here in Korea for this Friday. Cluster infections within enclosed indoor venues continue. Accordingly, authorities are highlighting the importance of seeking to minimize time spent at such settings and to frequently ventilate these places. Meanwhile, social restrictions under levels 4 and 3 are in place nationwide until the 3rd of October, with special Chuseok prevention measures also in place starting next Monday until the 26th, as Soa mentioned earlier. Now, meanwhile, for the social restrictions, for the broader social restrictions that is, among the notable changes are the reality that dining establishments establishments can cater to in-house patrons until 10 in the evening, even under level 4, and that a few more people can gather socially, provided the party includes vaccinated individuals. Under level 4, a total of 6 people can meet for social purposes during the day if the group includes 2 who are fully inoculated. After 6 p.m., a total of 6 people can gather if the party includes 4 who are fully vaccinated. Under level 3, a total of 8 people can socialize if 4 are fully inoculated against COVID-19. The briefing is about to start. We'll come back to you afterwards.
Here is Mr. Kwon Junuk with today's briefing. I am Kwon Junuk, and let us now begin our regular briefing for September 10th, Friday. First of all, on the COVID-19 vaccination front, lately there were some circles where also there have been administration of the vaccine doses that have expired. And here are some preventive measures to this. And first, all of the hospitals and institutions, they need to check the expiration date as well as the date for the storage. And as for these distributors, they need to also make sure that Pfizer and Moderna vaccines need to be also used within 30 days after they are leaving these cold storages. And to this end, the government also is going to have detailed guidelines as follows. First of all, as for hospitals, we are going to make sure that they can check the expiration date so they can so we will be place boxes and put labels on the boxes, both on the side and the front side of the boxes, so that they can check the dates very conveniently. And also, we will have an electronic system where they can also check the expiration date, also at the local community health centers as well. And you are going to have a warning pop-up on the electronic system so that they can be acknowledged. And also, as for the hospitals, regardless of the opening of the vaccines, we are going to make sure that these vaccine doses can be utilized for the surplus vaccines. And third, as for the administration errors, we are going to not provide the financial support of inoculation for these hospitals and also institutions. And we are going to put administrative orders, including warnings and even canceling of such a contract of inoculation. And fourth, we are going to provide a daily checklist where they could do a checklist of the expiration date on a daily basis before they roll out the vaccines on a daily basis. More in particular, they are going to check the type of the vaccine as well as the expiration date, and also at the waiting rooms and also the inoculation room, they are going to put up notices on what vaccines they are rolling out starting from the 13th of September. And also, as for administration errors, we are going to provide vaccination. However, if there are some reasons, if the reason has not been acknowledged fully, we are going to also acknowledge that this person has been inoculated if he or she refuses to get the vaccine again. And here are some clinical results of the COVID-19 vaccine. First of all, some of the side effects, and we have been carrying out such analysis of the COVID-19 side effects, and we are also looking at a large scale and large number of subjects, and we have also seen certain analyses, and we see that many of the side effects were fatigue and also depression, which are only mild symptoms. And as we seek to phasely return to our normality, and also as we try to tackle the Delta variant spread, we are going to cooperate with many hospitals here in Korea and also many institutions internationally, so that we can have a full grip of what the COVID-19 side effects are. And second, we also will going to provide some antibody testing results of the public. And to this end, we are going to provide the strategies for for the COVID-19 vaccines. And in order to have some more grounds for these analyses, we have been providing and conducting the antibody testings for the public, and we are going to cooperate with the Red Cross Center, and we are going to look at all of the people who have been donating blood across 17 cities and provinces, and we will be utilizing their samples to also look at the amount of antibody, and we are going to have a different sample by demographics, and starting from September we are going to have a total of 3 rounds of analysis, and we are going to look at a total of 30,000 people, and we are going to see how the people have been developing antibody after receiving COVID-19 vaccine and after being contracting with the virus, and so that we can do a comparison. And as we try to vaccinate the population, 70% of the population with their first dose by October, we believe that this could also provide us with a basic knowledge of how much immunity our public has developed. And as for the COVID-19 samples being cultivated at institutions, we have been also cultivating 119 new variant samples, and a majority of them, about 500 of them, were for the purposes of analysis and research, and most of them were of Delta variant. And as for the treatment, the remdesivir treatment drug currently has been administered to a total of more than 14,700 people here in South Korea. And the regular treatment, this treatment has been administered to a total of more than 13,900 patients here in South Korea across 101 hospitals. Last but not least, I would like to mention the following. The COVID-19 has also put us at a state where we are making a gradual transition into a normality, and it is very important that we only switch to with corona only when we have a full analysis and also study on the COVID-19 virus. And therefore, it is very important that we continue to have our medical research on the COVID-19. I believe that this is very important on top of the vaccine sovereignty that we are trying to develop here in the country. And currently, the Research Center of Infectious Diseases here in South Korea, which is the backbone of fighting against COVID-19, we are going to make sure that we follow and we develop the following 3 capacities. First, when we develop and when we identify infectious diseases, we are going to also develop our response capacity. And this means that if we have identified novel infectious diseases, we are going to look at the symptoms and also how to treat these diseases. And we are going to have the capacity to be able to provide guidelines, response guidelines. And second, we will be developing a capacity to also develop related infrastructures for clinical trials. And through these clinical trials, we are going to make sure that we develop our vaccines and treatments, and these clinical trial network will be established going forward. And third, we are going to cultivate the skills for research in order to be fully prepared for the unknown future. If we are encountering a new type of infectious disease, or if we are encountering a very hot and humid temperature due to the global warming, we will make sure that we respond accordingly with our medical capacity. And it is very important that we need to elevate our level of medical response capacity so that we can respond accordingly and immediately. And this means that next week we will have the special committee look over our 5-year plan, that is 5-year plan on research and development on the novel infectious diseases here in South Korea. And we are going to cooperate with our renowned members of the medical circles as well as researchers here in the country. Thank you very much.
Right, that was Kwon Junuk with Friday's afternoon briefing, and he spoke at length also about the measures needed to prevent vaccination mishaps, right, So?
Right, Sunny. So Kwon mentioned the government's extra measures on how to make sure that there will be no further mistakes when it comes to expiring vaccines. And that includes putting extra labels on a lot of sides of packages, for instance, and also warnings popping up on medical facility systems that show that vaccines are imminent, that their expiration dates are imminent. And according to Kwon, vaccines, according to him, must be used 30 days after coming out of the cold chain storage. And what officials also have mentioning is the possibility of readjusting the term between the first and the second dose when it comes to mRNA vaccines or Pfizer or Moderna vaccines, because earlier the term had been adjusted to 6 weeks after the first dose due to supply issues, but now that might be readjusted again to 3 or 4 weeks. We will have to see and wait for that. And that's all I have for today. And I'll be off now to get my first shot as well.
Right, so I ahead. So good luck with that. I'll see you next week.
Thank you. See you next week.
Advances on the local vaccination front are looking quite promising, but a cloud of vaccine hesitancy appears to be hovering above amid news of severe adverse reactions to COVID-19 inoculations and unfortunate cases of vaccination mishaps. For more, I have Dr. KimSeungTaek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Also joining us virtually is Dr. T.AnhWartel at the International Vaccine Institute. Good to see you again, Dr. Wartel.
Good afternoon.
I also have Professor Rosemary Dorrington at Rhodes University over in South Africa live on the line. It's a pleasure to have you with us, Professor Dorrington.
Good day.
Right, Dr. Kim, we'll start here then. What are your prospects on the government's plan of offering one dose of the COVID-19 vaccine to 70% of the population by the 19th of this month? That means 9 days from now.
I think it's quite just feasible right now. I mean, just considering the doses that are available and then still just being imported. And then I think the vaccination in Korea was a little bit, I mean, depending on which country we are actually comparing, but sometimes people just say a little bit delayed. But I think Korean people are just very good at just sort of just a public just campaign, so that I think we are actually very fast at just catching up with the vaccination, the vaccination speed. And then another thing that we have to consider is actually, in addition to the first shot, we also have to keep in mind the second shot, and that actually just completing just a vaccination schedule, because according to just recent data, especially on the some protection efficacy against especially some Delta variant. Now after the first shot with the mRNA vaccine and then the AstraZeneca, it's quite just it's actually lower than we actually expected. But after completing the vaccination, then the protection is just increases, so that's very high. So then I think very important to just complete the vaccination. Like in this case, after just Chuseok holidays, just complete vaccination is very important.
Right. Meanwhile, Dr. Kim, according to health officials also, among those unvaccinated, 14.5% will reportedly choose not to be vaccinated, and this is reportedly a 6 percentage point rise from the month prior. How do you explain this finding?
Well, there are some number of reasons, and then I think just first of all this is not new, but when we actually talk about the vaccine, we always talk about both just the benefit and then the risk. But then I think the risk most of the some side effects we are actually very well aware of, but then somehow just the side effects is very much. This is just a sort of very a focusing issue since the COVID-19 pandemic has actually started. But then this is not a completely new one. I mean, this is already known. And then there are some sort of just vaccination mistakes. For example, like some very wrong dosage and then expiring the vaccine. So that this actually somehow lead to the general public's concern. Then what about just if this kind of thing just happened to me? So there were some concerns, and also there are things like some incorrect information because now the variant. Well, since the last year there were numerous the variants, but well, of course, many scientists actually try to investigate the effect of the potential effect of this variant, emergence of these variants. And one of the things that the scientists can do very quickly is that testing the neutralization capacity. But neutralization, this is very important, and this is actually just testing the efficacy of the antibody that is generated after vaccination. But somehow just this result is actually just coming out very fast and very quickly, and then the people somehow just realize or notice that well, the vaccine efficacy is substantially reduced. But this is just only one side of the story. But generally, after vaccination, we actually just observing both just the neutralizing antibodies and also some T cell activity and also memory cell responses. So this is only just one part of the vaccination story. So I think for more comprehensive information should be actually delivered to the people, not just only just a small aspect of the vaccination effect.
Right, only partial information,
sure,
you mean.
Sure.
Meanwhile, Professor Dorrington, what can you share with us about the vaccination drive over in South Africa?
We started doing our vaccination at full speed in May. And currently we're vaccinating adults. These are people over 18. And we already have 36% of the target population have received a single dose, while 24% of the target population is fully vaccinated. And they represent about 25% of the full population. We're using the Pfizer vaccine in South Africa, and we're also using the Johnson & Johnson vaccine, which really works well for us, particularly in the rural areas, because it's a single-dose vaccine. And so we can get people fully vaccinated far quicker with Johnson & Johnson. I might just add that in addition to vaccination, South Africa has a very high infection rate. And our blood tests suggest that well over 40% of South Africans have been exposed to the virus. So we're now beginning to see not only the effects of vaccination, but also some partial immunity that is provided by exposure to the virus.
I see. Meanwhile, Dr. Wartel, vaccine hesitancy is not a new phenomenon, and yet that associated with COVID-19 appears to be receiving quite a bit of attention. What are your thoughts, Dr. Wartel?
Well, while a lot of people are now being immunized with COVID-19 vaccine, some groups of individuals remain quite reluctant, whether they delay or they refuse vaccine, which is not very specific to COVID-19. It has occurred in the past already with other diseases of vaccine. Vaccine hesitancy is not new to COVID-19. It is a complex topic. It is also a context-specific topic varying across time, place, and vaccines. This has multifactorial components such as complacency, for instance, lack of perceived need or value of the vaccine. It could be due to convenience or confidence, a level of trust for a vaccine. So to me, vaccine communication and public trust have to be cautiously managed under COVID-19, particularly when it comes to perception of risk of side effects and causality assessment with the vaccination. So you can ruin a vaccination campaign overnight if it's not managed properly. And for COVID-19, we don't have the luxury of time to recover from a miscommunication or misinformation to the public. So we do need to consistently communicate clearly and concisely the scientific information to the public, including those that are delaying or refusing the vaccine, because the more you vaccinate, the more you impact the virus spread.
Right. And going back to the idea to talk about side effects that you mentioned, Dr. Wartel, quite recently, talk about COVID-19 vaccines leading to leukemia was quite rampant here in the country, but authorities have ruled out any causal link. Have there been similar talks elsewhere, and what are your thoughts on this matter?
Well, the safety assessments, whether it's through the case reports of side effect or safety studies being carried out for the authorized vaccines, even in post-authorization period. And there are regular COVID-19 safety updates issued by regulatory bodies such as the European Medicines Agency that has lately issued a report on the 8th of September. I didn't see leukemia being raised as a safety issue or concern at this point in time, except the recent reporting from Korea. And as you pointed out, I understand that the Safety Task Force in Korea has thoroughly reviewed the cases, the reported cases, and no evidence of causality has been established. And furthermore, I would say, remember, leukemia is a progressive disease in which the bone marrow and other blood-forming organs produce a number of immature, abnormal white blood cells, if you will. So it's a long process that takes time. So to me, the time window following immunization is an important information to consider when you assess the safety event and the causality.
Right. Dr. Kim, another factor contributing to vaccine phobia, if I may, is the reality that proving a link between a sudden death and the COVID-19 vaccine is quite tough. Could you tell us a bit more about this?
So actually, for the potential side effects of the vaccines, actually, sometimes it's really just difficult to actually just demonstrate any causality. But then in the previous clinical trial, phase 3 clinical trials, that also actually just testing the vaccines 20,000, at least 30,000, 40,000 people. That time, actually, most of the side effects can be just identified. But then, even after that, in real world vaccination, now we are actually just vaccinating more people. Then the more cases are accumulating. So then we can, if there are more cases, then the scientists and vaccinologists now can look into what is the actual, if there is any cause and effect in the case scenario. But there are actually many cases of sort of just coincidences. I have some story from one doctor, and then the doctor actually tried to vaccinate one lady, but then lady actually just experienced seizures right just before 10 minutes just before vaccination. But if just the vaccine was administered before seizures, so then maybe just that sort of just the patient might just suspect that seizure just came from the vaccination. So there are many just sort of just cases of coincidences. So that we have to actually rule out some coincidences, and also. For example, also some blood clotting from the AstraZeneca vaccine. I think as far as I know, there was no serious issue in the some phase 3 clinical trials. But in a real world experience and out in the European countries, when they there were just more cases of vaccination by AstraZeneca, then they start to observe this kind of things in many different countries. So it's a common just sort of just side effect. Then scientists and then clinicians now look into that. Then what is the reason for just behind it? Still, the blood clotting, we do not know for any clear the reason for that blood clotting, but there seems to be still there are some the correlation between the AstraZeneca vaccine and then this the blood clotting issue. So it is not really. In conclusion, it's not really easy if the case is the number is very small, and then whether it is just a simple coincidence or really just some effect of the vaccination.
I see. Right then, aside from blood clotting resulting from AstraZeneca, potentially resulting from AstraZeneca vaccines, Professor Dorrington, what are some other proven side effects of COVID-19 vaccines, and how can we seek to respond to them?
In South Africa, we've done extensive clinical trials, particularly with the Johnson & Johnson vaccine, and we now also have accumulated a lot of data in South Africa for the Pfizer vaccine. I just want to reiterate, there have been some issues of blood clotting with the Johnson & Johnson vaccine, particularly in women under the age of 50. But in a trial of 250,000 people, there were 35 incidences, and most of those were with patients who had a history of blood clotting. So it's really important to consult your doctor to decide which vaccine you're going to get if you have a medical history. in terms of the Pfizer vaccine, there have been some reports of Guillain-Barré syndrome, which is a neurological side effect. But in South Africa at the moment, those incidences are very low, and we don't have evidence that they are at a rate that is higher than in the normal unvaccinated population. So the cases of serious side effects that are directly associated with the vaccine are very rare.
I see.
However, there is a lot of misinformation that suggests that the vaccines are causing thousands of deaths that are being circulated on social media, and that's really important for us to address to the public, because the biggest problem with vaccine hesitation is fear of side effects.
Yes, it is. And we'll get into that in a bit, Professor Dorrington. But first, Dr. Wartel, apart from reports of adverse reactions to vaccinations, cases of mishaps ranging from the use of expired vaccines to unapproved cross-inoculation to dosage errors, these all have aggravated public concerns. First, then, what are the potential risks of these mishaps, the ones that I've just listed?
As a healthcare worker, when you vaccinate people, you need to follow the vaccination good practice, right? From the product preparation to its administration to the healthy people. So that's very important, and you need to follow the national recommendation or guideline. And I understand for Korea in particular, the health authority have really reacted quickly to put in place corrective actions to avoid, having again some errors with expired vaccines. So for that situation, I would say for the expired vaccine, there's no safety concern anticipated per se. There might be some concern related to the immune response elicited with injection that has not been properly injected. So that's for the first situation. The second situation about the cross-vaccination, and actually in the field of vaccination and vaccines, interchangeability, when you change a vaccine to another one, that's something that is used or that is done. And it is also of interest for COVID-19 pandemic for two reasons, this interchangeability. Because you can address the question of the supply and logistics challenges given the global need. And the second reason is the booster strategy that is now being discussed. So in other words, there are studies that are ongoing assessing the different combinations. They are called mix and match studies to generate additional data, including safety data, to have the countries make their own recommendation how to use different vaccines. But again, you need to follow the health authority guidelines and recommendation in Korea.
Right. Dr. Wartel, what else do you propose to prevent these unfortunate incidents of vaccination mishaps?
Well, what else? Recommendation is to transparently talk to the healthcare professionals, to the doctors, to the vaccinators, and share your concerns. We know actually that misinformation will come with the pandemic. In the age of social media, when people are overloaded with multiple information at the same time coming from multiple sources, and on the other hand, we also have an audience that is well informed, very well informed. So again, the public trust is key, along with transparency, dialogue, and engaging with the stakeholders, access to accurate information and consistent information from scientists to healthcare professionals. These are critical components to ensure that people understand what we are doing and the information we are conveying. So people still trust GPs, pharmacists, healthcare professionals. So talk to your doctor, talk to your medical staff.
Right. Dr. Kim, this is something Professor Dorrington touched upon, but also here on the local front, there have been frightening online accounts of healthy people in their 20s and 30s dying after vaccinations. So some young people are saying that the risks of COVID-19 vaccination outweigh those related to infection. What are your thoughts?
Well, for the people in this the age group is they have actually just a relatively low risk. I mean, compared to the people, just old people or people with some underlying diseases. But then they are at a lower risk, but they are not at no risk. And one of the things that we have to actually just consider is that the long COVID, What it means is that we actually just talking about just infection and things like that, because this is currently the big issue. But even after the recovery after the COVID-19, I think according to the very recent report from the KNIH, and also there were some reports from some foreign countries. But then the long COVID is very quite often observed from many of these recovered people. In Korea, it's like it's just 50%. And then also the symptoms are very different, very various different, and then also severity is very different. And also it's actually imposing very just substantially long period of just suffering for this recovered patient. So we have to think about this long COVID even after recovery of the COVID-19. And also, in the end, we actually talking about just the lifting of just the mask mandate, and then just moving, returning back to our sort of just normal. But then, and then also experts somewhat just agree that COVID-19, this SARS-CoV-2, will just remain with us. It's not going to go away. So it's like an influenza virus. This virus, whether we like it or not, we will stay with this virus. So that what it means that everybody will have a sort of just more just high, whether it is more it's like likely to just the contact or like just being exposed to this virus. So then I want to just ask a question: are you going to be just be exposed to this virus, vaccinated or unvaccinated? Right. So we actually have to ask ourselves whether we have to vaccinate or unvaccinate before just being infected.
Right, because this virus is going to stay with us.
Sure.
Professor Dorrington, now you mentioned this earlier, the presence of distorted information in South Africa affecting the inoculation drive there. Give us some other examples of the misinformation with regard to COVID-19 vaccination that is circulating over there in South Africa.
So interestingly, the highest rate of vaccine hesitancy is amongst males in South Africa. When the 57% of the vaccinated population are women. And there are quite a lot of rumors that circulate that the vaccine affects fertility, which have been debunked, they're false. Also, people have been thinking about other remedies. We have a strong cultural resistance to vaccination, and it's been really important to have members of the community, such as churches, pastors, and in South Africa, particularly traditional healers, informed and able to go out into the community and deal with the myths and misinformation about the vaccine. And we found that that's really effective to motivate particularly vulnerable communities, those over the age of 15, to go in and get vaccinated. And we've had really good responses to that. It's the younger generation who think that they are not going to be affected. And now with the incidence of the Delta variant, everything has changed because the Delta variant is now predominantly infecting the younger population and also children.
Right. Also, Professor Dorrington, what can you tell us about the use of ivermectin as treatment for COVID-19?
So ivermectin is an antiparasitic compound that is used to treat, that has predominantly been treated for veterinary use in animals to treat parasites such as tapeworm and roundworm. And there has been a couple of studies that are unproven and clinically unproven that suggest that ivermectin might be a way of treating, preventing COVID infection and treating severe COVID infection. However, there is absolutely no proven clinical data showing that ivermectin has any effect. And even the manufacturer of the compound, which is Merck, which is the fourth largest pharmaceutical company in the world, has issued a statement saying that they have no data whatsoever that shows that ivermectin is effective. That said, people who are desperate, and particularly those who are vaccine hesitant, are persuaded to take this compound, this drug, and in taking it, they think that mistakenly think they're being protected from infection. And we have very sad stories in South Africa of many people who've been taking this drug instead of getting vaccinated, who have fallen ill and died of COVID. So it's really important to put that information out, particularly amongst medical community, some of which are prescribing the drug.
I see. Meanwhile, Dr. Kim, one final question to you then. What do you suggest to ease possible fears over COVID-19 vaccines in general?
Well, as I told you earlier, I think just a comprehensive view of some positive effect of the vaccine should be just correctly delivered, not just a small, just a partial effect of the vaccination. Like I said, for the protection efficacy against the Delta, it's that neutralization effect is obviously reduced, but generally just vaccination, the protection efficacy is still pretty good. So that kind of information should be delivered very correctly and comprehensively.
I see. So correct delivery of information, correct information, that is.
Yeah.
All right, Dr. Kim, thank you very much for your thoughts. Dr. Wartel, thank you very much for being with us today. And Professor Dorrington over in South Africa, thank you for your time.
It's a pleasure.
Right, well, that brings us to the end of this edition. We'll be back with more prompt and precise COVID-19 information next week. Join us then. Have a safe weekend.